Hello, participants. My name is Narpaul Persaud, and I am a fourth-year medical student at Kansas City University. Welcome to the first module of the study purpose and alternative therapy. So, today's plan is to focus on the background information of the study, as well as to summarize the purpose of the study and how it will be carried out. We are in an opioid epidemic. It began in the 1990s when pharmaceutical companies reassured the medical community that patients would not become dependent on opioid medication. This led to overprescribing by the healthcare community, which resulted in widespread addiction. The opioid epidemic continues to worsen. Every day, more than 130 people die from overdose. In 2018, more than 10 million people misused their prescription opioid medication, and over 2 million people had opioid use disorder in the United States. There are different methods of treating opioid dependence, including outpatient counseling such as group therapy, inpatient addiction programs, and medications such as Suboxone and methadone. Suboxone is a standard of care for opioid dependence here at Ozark Center. The CDC now recommends physicians to first offer alternatives to opioids prior to prescribing them to patients. These include treatments such as therapeutic exercises, cognitive behavioral therapy, yoga, massage, non-opioid medications such as ibuprofen, as well as other advanced methods such as nerve block injections, heat, electrical stimulation, etc. One alternative treatment we explore in this study is the use of osteopathic manipulative therapy, also known as OMT. OMT is a non-invasive manual therapy that aims to restore optimal function in the body. Like massage, OMT treats musculoskeletal problems. However, it also works on targeting other systems of the body, such as the nervous and the circulatory systems. OMT embraces the osteopathic philosophy that all body systems are interconnected, and when given the right support, the body has an inherent capacity of self-healing. As an example, when you loosen up the muscles of someone's back, you are also affecting the circulation and nerves in the area, which can then lead to improved healing and decreased pain. These less tight muscles may also help your posture, which can improve your breathing, and so on. OMT is practiced by doctors of osteopathic medicine who are fully licensed physicians who undergo rigorous medical school with an extra 200 hours of specialized training in OMT. Many of them also go through further training in OMT as well. There have been many studies done over the years supporting the use of OMT in a number of conditions such as chronic low back pain, shoulder pain, fibromyalgia, asthma, pneumonia, as well as a number of other conditions. Some recent research includes a study that was done in 2020 that demonstrated that 6 sessions of OMT over 3 months led to decreased low back pain intensity and reduced medication use in patients with chronic low back pain. Another study in Italy showed that 8 treatments of OMT within 6 months were able to decrease severity of migraines. In addition to treatment of the body, one of the major principles of osteopathy is to treat the mind and spirit. Therefore, patient education and counseling may also play a role in pain control and improved quality of life. A study in 2018 found that patients who had a total knee replacement procedure needed less opioids after surgery if they were given patient education compared to those who were not educated prior. Another study in 2010 found that patient education through videos had better clinical outcomes than patients who were taught through reading materials. Now that you got the background information, this now brings us to our study. This study will include adults who meet criteria for opioid use disorder and have either side effects from Suboxone, such as headaches, ongoing cravings for opioids, or low back pain. Patients will be randomly assigned to one of 3 groups. First is the standard Suboxone treatment. Secondly is the Suboxone treatment plus OMT. Thirdly is Suboxone treatment plus educational modules, such as this one. We hope to determine that OMT and patient education combined with the standard Suboxone treatment will lead to reduced frequency of chronic pain, specifically in the lower back, reduced frequency of headaches, reduced frequency of opioid cravings, reduced depression and anxiety scores over time, as well as reduced cortisol levels, which is a marker of stress, which we will measure from your saliva samples. Now, this brings us to the end of this week's module on study purpose and alternative therapy. Next week, you will be learning about opioid use disorder. Thank you for participating in this module.